Thank you first for inviting me to talk. So I'm the founder of Immersive Rehab, and about 9 years ago, my life basically changed in a second. I was hiking, as you can see on the left in Ireland, being very active, enjoying life. And 6 months later, I had a severe work accident that basically left me immobile for a very long time, having to go through a long rehab period. I had no balance or lack of balance for about 2 years, and going through that long rehab myself, I often felt isolated, for example. Just by, initially you have a lot of rehab, then over time rehab kind of reduces, but you're still not mobile enough to actually do things yourself, go out by yourself, so I was stuck in bed. And also the way rehab was being done often was very demotivating. You often didn't see the point of it when you have to do repetitions 20 times this, 20 times that. And so I started thinking of there must be a way to change the way rehab is being done, make it more engaging. And I'm an engineer myself, mechanical, biomedical, so I started thinking, how can we use technology to change the way rehab is being done? And I started looking into other conditions that are really heavily impacted by neurorehabilitation, such as stroke, spinal cord injury, MS, cerebral palsy, for example, as well. And I came across staggering numbers in mobility gains for those people. For example, when talking to physios and occupational therapists that treat, for example, stroke patients, their gain of upper limb mobility, for example, on average, is about between 15 and 20%, which is very low, and people only have about 6 weeks of rehab. And then when they leave the hospital, they have too few mobility to actually live an independent life. They will lose a lot of the rehab, for example, lower limb mobility that they have gained because they don't have upper limb mobility. So they're back basically to square one. Also because there's a really big gap in follow-up rehab. Either there's nothing offered or there's really long waiting times. So I started looking into mechanisms. So there must be a mechanism in particular then for upper limb rehab, for those specific groups of neurological conditions, to help them to gain more of that mobility back. And I came across a concept that is called neuroplasticity. Neuroplasticity, we all use it when we learn something new over and over again. It becomes a natural thing, basically. And essentially, when you have a stroke, for example, part of your brain is damaged, which affects your mobility. But in essence, there is nothing wrong with your arm, for example. But the problem is that the connection between your brain and your arm is broken. So essentially, what could help is to reinstate the connection between your brain and your arm. And that would be possible by rewiring your brain so that an undamaged part of that brain takes over the damaged part and reinstates the mobility. And you can do, obviously, like by training and repetition, and that's what physios try to do with neurorehabilitation. When you achieve a certain number of repetitions, you're able then to achieve certain goals and certain goals in mobility. And that is basically where virtual reality comes in, because we can use virtual reality to allow people, and I'm talking about the fully immersive virtual reality, where we can allow people to engage with objects. So like this case, in the normal rehab, they often can't even move it from here to there. They get really frustrated by doing this movement, they tune out. The consequences are that there's no compliance, they don't have the number of repetitions, meaning that when they leave the hospital, they have no fine motor skills, hardly any mobility themselves. And then on top of that, there is really very slow and or no access to follow-up rehab. In certain wards that I was talking to, a complex spine unit, for example, they have waiting times up to 9 months even just to get to rehab, which basically one leaves a very big, they lose a big window of opportunity to get better, but two as well, those people get really depressed. And then at the time that they move into rehab, basically, they don't really see the point of it anymore. So that's what we want to tackle. By using VR, we can create an endless number of interactions, interacting with virtual objects, and really use that to trick the brain because it's so immersive and people think that they're moving objects around, even if they don't have any weight. But that takes away the aspect of not having the strength actually to pick up objects and offer quicker access, as we can deploy VR in any hospital room, really. And this is one of our this is our platform. It's one of our exercises where you basically need to build towers. It's based on the grasping method that stroke patients have to do on a daily basis. And it's based on reaching, grabbing, lifting your arm. And here we give them a challenge. So they don't think about, I have to do this movement 20 times or this movement 20 times. Here they're actually also using objects. They have to do it within a specific time frame. And the patient that you can see here is a Paralympic athlete who was paralyzed 3 times from the waist down and upper limb affected like a stroke. And he was using constantly visual simulation as well during his own rehab as an athlete. And he was walking all 3 times again after 8 weeks. So he's been a great advocate and also giving kind of input into our development. So I just want to go over 2 case studies of people that I have worked with, and one is a male in his 20s. He had a complex spine injury and also traumatic brain injury, and because of the traumatic brain injury, he had a severe concentration deficit, meaning that because of that concentration deficit, he would not be able to do his physical exercises either because he would not be engaged. But within our experiences, he was in it for 10 minutes. He really was having fun. And obviously there's a novelty aspect, but this is someone with really severe concentration deficit. So that was really a positive result. The other one was a man in his 60s. He had just had a stroke, one side affected, and he was just doing exercises with the physio before, so that was asking him to move his arm just to the right on top. And when he was moving it to the right, he was like, yeah, I can't move it further than this. When he was in our exercise, he was just doing the challenge, basically. I have to build these towers, and he was reaching a lot further in a very safe way. But there's this, blockage. If you've ever had an accident or you lose your confidence basically as well. So, and you don't want to overstretch, for example, or you think you can't do it anymore, so you don't want to go there, but actually he was able to do it. So for him, it was really nice to see it himself as well. I can actually do it without any issues. So, so our software is, it is a medical device. So as we are creating personalized exercises that are tailored to the patient, that are also changed according to the patient's progress. We will go into remote patient monitoring. So initially we focus on hospitals in the first stage, in acute phases. In the second stage, we will offer it to people in their homes upon referral by the physio so that they can be followed up remotely. Create a patient community around it and really treat different conditions with an initial specific focus on upper limb rehab for these neurological conditions. There's definitely key challenges to running a health tech startup, and in specific then it is a medical device, so the key is to obtain clinical evidence. And also because we're using a very new technology, which is virtual reality, there is no really long-term studies that have been done in a clinical setting. So that is very crucial to be able to, one, to obtain this clinical evidence, so access to patients, access to clinics, also access to the resources to run a full clinical trial is really key. And then I mean funding, also getting regulatory approval across the EU and outside of the EU, and complying with the new medical device regulatory regulations that come in place next year. So that will be really important. Then the next challenge is that there's so many stakeholders in healthcare, which all have their say, obviously, in what really comes into the healthcare space. And for us as well, the main important things is the safety and helping patients and improving patient outcomes. So we really need to be able to just engage with all these different healthcare professionals, patients themselves, obviously, which are really a critical part of the whole process, insurance companies, regulatory bodies, and then procurement managers and commissioners in different healthcare settings. And then I come to challenge 3, and that is a very big challenge as well as the reimbursement plans that for these type of digital tools and healthcare technology tools. And there's quite a lot of challenges because in every EU country, there's a different healthcare system in place, both public and private. There's a lack of reimbursement plans. There are some countries that are looking into it in reimbursement plans for digital health tools, for example, and mobile health tools to be able to, once you have clinical evidence and you can show that it really improves patient outcome, you can actually get reimbursed as an organization, for example, and as a patient. And so I think the need for these unified reimbursement plans, in particular and across Europe, is really critical to have a reach of these digital health products across Europe and really give patients access to what they need. And I mean, I'm Belgian. I grew up in the capital of the European Union. I lived and worked across Europe for the past 13 years. So I've kind of experienced different healthcare systems, and I think it's really crucial that we all have to come together, especially within healthcare, to be able to give patients the healthcare that they need and deserve. And I won't be able to do it on my own. It's really a collective effort. So yeah, thank you, and please reach out when you have any questions.